Hi, Joan.
Hi, Dr. Jill. I was hoping you could help me with my cat, Henry, who I'm holding down.
Hi, Henry handsome. How's Henry doing today?
You know what? He's doing really well, and he remembers that you're one of his favorite people, that years ago you really helped him through cystitis with the cold laser, adjustment, acupuncture, and then I did a lot of anti-inflammatory foods. If I'd had CBD at the time, I would have done that, but I did a lot of anti-inflammatory and really worked with his diet to keep it at bay, and he's never had...
I was going to say, has he been having any problems?
Never.
Excellent.
And that was like 6 years ago.
It's such a common disease with cats, feline neurologic syndrome or feline lower urinary tract disease. And a lot of it really does go back to, one, either stress, diet, anatomical issues, so sometimes it can be related to some pain. Sometimes they've had urinary tract infections and they still feel pain too. So a lot of it goes back to the brain. There's a lot of brain work, which is why I like adjusting these cats, because you're adjusting not just the spine over top of the area where the bladder is, but you're also adjusting the neck and the head and the brain, and it helps to just relax everything and help with memory and help them realize that it's not painful anymore, because sometimes they still think it's painful.
Yeah, and as an animal communicator, I see that all the time. And not only do they still think it's painful, I think that sometimes there is such subtle inflammation still in there, such subtle...
Yeah, and it can be in the back, it can be in the penis, it can be in any of the sphincter areas. And some of it can even be self-trauma, because sometimes if they have a little inflammation, they'll start licking with that wonderful cat tongue that has a lot of abrasiveness in it, and if they're licking their penis, they can create a lot of trauma. So sometimes getting rid of the cycle of inflammation can totally get rid of the feline neurologic syndrome.
And I'm going to bring up one more thing that I see all the time, is usually those are the cats that are internal worriers.
Definitely.
And he definitely used to internalize everything.
Yeah. So earthy cats, the ones that are just really worried and concerned. Both females and males will have this syndrome. I think I probably see it more in males than females, but there's a lot of cats that have issues that go back to them worrying. You get a new cat in the house, a new baby, a new husband.
Mine was Delilah.
Anything like that can just totally upset their world, because you've brought someone into the herd that wasn't pre-approved.
And it's funny, because he was the one that picked Delilah out, and yet it was 6 months later that he came up with that. So even though he loved Delilah, it was still stress for him. So stress doesn't mean they don't like it. It's just, it's a lot of pressure on them, and it becomes, and if they're internalizers, then they're like, uh-oh, over here, and I'm going to pee, because I have now the pressure in my physical body because of the stress.
Exactly. Well, let me just get a feel of Henry. I haven't felt him in many, many years, as far as just going down and feeling how his head is connected to his neck, how his neck is connected to his shoulders. Hi, Pumpkin. I know. Yeah. No, he feels really good. How old is he now?
He's 9.5.
So that makes him officially a senior, which means he's probably got a little bit of arthritis in his spine, too.
Yeah.
So, especially with this jungle gym, he's an active guy.
He plays rock'em sock'em every day.
I've seen a little rock'em sock'em. So what we're going to do is we're going to adjust his spine with this wonderful chiropractic instrument. It is called a clicker in some worlds, a chiropractic manipulator in other worlds. This is something called veterinary orthopedic manipulation, and I'm going to do a pass just right down his spine, starting at the head and going back, and then I'm going to do that again. And you can see when I do it, him having like little reverberations or vibrations at certain places, and that means that he's out a little bit as far as his adjustment. You can see a little tail twitch there too. So right over his spine, and we're getting to the area right now, which is over the bladder, but he definitely has a little bit of lower spinal disease right through there, which is common for his age. One more time. Let's see what happens. Sometimes the third time we get rid of a little bit of that, which is good, which means that our adjustments are working, because I'm not seeing near as much activity with the tail, except for him trying to leave. And now I'm just going to go down the bladder meridian, which is about 2 soon or 2 fingers breaths off of the ventral midline. And I had one little adjustment right on his lower back there. So good. he feels really good. So when we adjusted his spine, he corrected everything except for one little place on the third pass, which is great. I think he feels like he's in a good place for 9 years old. All right, how about some acupuncture needles?
Oh, good.
All right.
I just realized, I just did the math in my head. So if Delilah is 7 now, he started having the problems 6.5 years ago, because it was in the summer when you would come and work on him and my horse and my dog.
Okay.
Yeah, so that was 6.5 years ago. So that's pretty good that he has not had.
No, he's not had any reoccurrences.
Yeah.
Because FUS is really hard.
Yeah. Okay.
But you worked really hard to get rid of it, and you worked him through the stresses. So,
I worked through the stresses a lot.
But even sometimes, like when you moved, I mean, something like that would come back to him, and he did fine.
And we've moved twice.
Okay.
And we brought in more animals.
Yay.
And we've had some animals die.
All right. So we're going to do some acupuncture on Henry today?
We're going to do some acupuncture on Henry. I'm not going to. You want to.
All right. Well, what we're going to do is just put a couple little needles in him. And what we're working on is his arthritis that we figured out through his age and through his activity. That's pretty normal for a cat his age. We're going to put some needles up behind his ears and between his shoulders, and then we're going to work over his lower spine. And then while these needles are incubating, we're going to put a little laser on him too. We're going to do some cold laser therapy. What do you think, Henry? More, please. Henry's had acupuncture done, but it's been a long time. I would say most cats really accept acupuncture. Especially if they're used to being touched and they like to be touched. You know, your kitties that are shy and aren't really liking anyone to touch them, especially strangers, acupuncture might not be the best therapy for them. But those cats can always, always get cold laser therapy. So I just put that in his spine at over his bowway, and he reacted a little bit to that, and that's because he's got arthritis in that caudal spine that's right over his pelvis. So. And if you've ever had acupuncture, most of the time you don't feel those needles going in, but if it's a place that's really, really painful, they can have a little bit of pain. So you always want to be careful. You always want to make sure that your holder doesn't have a little get bit or I get bit or something like that. But since we've worked on Henry before, that's not really a concern at the moment, but you always want to be cognitive of that.
And the handler, meaning the owner, if you have any energy around the idea that you're nervous for your animal, maybe you shouldn't be the one holding, because...
Yeah, many times it's best to get someone else to hold. Yeah. Vet assistants or, you know, another massage therapist or even a friend, or if there's someone else in your family that just doesn't have that type of energy, you really need to have a good holder. I don't work with a holder that's not good. It's just too dangerous. It's not good for the animal and it's not good for the vet. All right, let's do some cold laser. So this is an Urconia cold laser. It has 4 different beams. 2 of them are going to be red and 2 of them are going to be purple. You're going to see the purple beam. I'm going to program it for feline arthritis, and then what I'm going to do is I'm going to point it down his spine. I'm going to go from the brainstem to the lumbar spine. It's a class 2B, so there's no problems that everyone in the room needs to wear protective safety goggles. You just need to not aim it directly into the eye so that it doesn't go to the back of the retina. What I'm going to do is put this on for 3 minutes at a time for movie purposes. I'm not going to do the whole thing, but I would do for him arthritis for 3 minutes. I would probably do scar tissue for 3 minutes, and then I would do inflammation and pain for 3 minutes. Cats with their acupuncture sessions, I usually only go anywhere from 10 to 20 minutes, depending on how they're reacting to the needles, how everything's going, because kitties are smaller. They don't need the time that dogs and horses do, the same way as when you're doing birds or really small vertebrates. The time that the needle needs to stay in is less. And even if a needle does fall out, it happens all the time, we call that the wiggle factor, they're still going to get that puncture site. And especially with having the cold laser, you're still going to get the same activity, but I love to see if I can leave the needles in for a good 10 minutes if I can. So I don't know if you can see on the camera the purple light. It doesn't show up real well. Let me put this down. And then you can see that purple light there. It's pulsing. And that has just numerous applications. The purple or the violet light we use for internal medicine types of things, and I use it a lot for dermatology. It helps with arthritis, lymphatic drainage, liver detoxification, scar tissue. We use it for anxiety as well. But the addition of having the violet light has really helped me as a practitioner, because I see so many greater and faster responses from the cold laser therapy. When I added cold laser therapy to my practice, first I started with acupuncture, second I started the BOM or orthopedic manipulation, third I added the cold laser. The cold laser got me the best and fastest instantaneous gratification in this world, with everyone having cell phones, everything on the internet. Everyone wants something bammo now. And with acupuncture, it doesn't usually happen that fast. With the orthopedic manipulation, it happens a little faster. With the cold laser therapy, dogs that walk in the room, cats that walk in the room, when they walk out of the room, they already feel better, like instantaneously. We're almost done. Thank you for being our model, Henry.
So handsome. And you know, one thing you talked about was this lower area where older kitties tend to get arthritis. That right there could cause litter box.
Oh, definitely. With urine or with fecal incontinence. I have a lot of cats that won't poop in their litter box. They start to get a little arthritis, and then they don't want to go in and out. Some of it can be because some of these people have these huge litter boxes that they have to jump in and out of. So seniors don't need those big boxes. Seniors need a box that can get in and out, that maybe have just a small lip, especially if they're a 20 or 30-year-old cat. You know, a younger cat can still go over the brim, but older cats should not be expected to do that. It's painful to go in the box, and then it's painful to poop, or it's painful to urinate, and then they don't want to go in the box anymore because they associate pain with the box and not necessarily the pooping or peeing. Does that make sense?
Oh my God, it makes so much sense. I try to explain this to clients all the time, because it seems to them that nothing's changed.
Everyone thinks it's a behavioral problem, and yes, it can be a behavioral problem, but you should always see your vet or your energy worker and talk to them, because many times there is a spinal pain component as well, and you need to fix the whole animal. I mean, that's why we call it holistic veterinarian. I'm not just giving him a pill for what they think might be a urinary tract infection. We're fixing the whole thing. We want to check if he has a urinary tract infection, and we did that with him originally to make sure that he didn't have a urine infection years ago when he was having problems.
I did all the blood work.
Did the blood work, got the urine checked. I think we checked that urine 2 or 3 times, and every time it was a sterile cystitis, meaning that there was no infection, just inflammation. But inflammation causes pain.
And discomfort, and anything that's, it can make it harder for them to poop if they've got inflammation near the bladder. I mean, it can mess all of it up.
Well, and then it messes everything up because they have that wind up with their pain. You're not just treating the bladder area anymore. You're treating the brain. You're treating the rest of the spinal column. You're treating the endocrine system, because now you have cortisol going high and
they're
low.
nervous and like, oh my God.
And then a lot of these cats will become diabetics, or they'll have IBD, or they'll have other syndromes. And some of them can just be started by anxiety or pain, or both. Henry, you're the best.
Yeah, but not Henry.
No, Henry's great.
Henry reigns the king. But even the king gets secretly treated.
Yes, he deserves it. I mean, I think truly every animal and every person should have some type of body work done at least once a month, minimum. I mean, I try and get my body work done at least once a week, sometimes more than that. But especially your seniors, because you know, I do anyway, at my age, your back starts to hurt, your neck starts to hurt, your shoulders start to hurt. Getting your body work done, having some type of mindfulness, meditation, not medication, and then exercising and diet. If you can keep all of those things in check, you're gold.
We're gold, Henry, we're gold. We meditate every morning, and we do scalar wave every day.
Good job, Henry.
Henry, you're being so good.
I wish all my cats were perfect like Henry. Definitely
so perfect.
The perfect cat. For time completion, this is 10 more seconds, and then we'll take him out and we'll work on turn the teeth in.
Mm-hmm.
He should have a good treatment though. He got more than 10 minutes, I think.
Okay.
Alright, let's take out your needles.
There's one over there.
And when we take out the needles, I always like to close the chi hole, which means just touching over top of where the hole was. Every now and then you can have a little bit of blood, very rarely, but sometimes, and if you do, that usually indicates that there was a stagnation there. It's usually really dark blood or kind of purplish blue.
I know.
But that way you just want to touch and make sure that there wasn't any that had any pain, especially that one that was put in the bowel area. He's not painful there now.
Thank you, handsome.
Pretty good.